So this relates just to the structure. If you have innovative approaches, an innovative way of, in a different way of organizing it, that is fine. But you should be very careful because all the research objectives of the topic should be in any case addressed. So make sure that you pay attention to that. The EFPIA contribution is an in-kind contribution. And it will be, it is indicative in the sense that it will be refined in the second stage of the project when the full project proposals will be prepared, because when the expression of interest consortium will meet the EFPIA consortium to form the full project proposal, then the in-kind contribution will be much more detailed and specified, because it will be adapted to what the consortium, the academic consortium offers. Then the IMI contribution for this project, as well as for all the safety and efficacy projects, is between 5 and 20 million euro. Of course, in your project, you have to, to request the needed funds according to the structure of your project and the size and so on. I mean, about the depending on the characteristics of your project. And then but the range is this. The indicative duration is 5 years. Some tips I would like to give you is when you prepare your expression of interest are that you should read carefully the IMI guidelines. Keep in mind, please, that they are different from the FP7 guidelines. So that's why I underline this, because there are several different features that you should pay attention to. And then the structure of the expression of interest template should be also followed carefully. There are 4 sections there. All of those 4 have to be included in the submitted proposal, because if some of them are missing, the project cannot be considered eligible for evaluation. And then also the expression of interest is formed of part A and part B, and both of those also have to be included in the project, in the submitted project. And the scientific objectives, as we said before, they have to all be addressed by the consortium applying for the expression of interest. And finally, remember to finalize your submission. We have an electronic tool for that, but if you don't press the finalize, we will never be able to receive your proposal. And then you will find just some addresses. So you will find the rules for participation and submission on our website. You can also contact IMI through the info desk. Regarding questions, questions regarding the topic or the EFPIA contribution or other things related to the EFPIA companies should be in any case addressed to us, and we will take care of contacting the companies. So you should not have direct interaction with the companies, and this will ensure fairness for all the applicants. And then, well, you know that today there are some info booths outside. They are still available for questions related to the rules of IMI. And then also I would like to announce that very soon there will be on our website this tool that is for searching a partner. Many people need to search for a partner for some projects, or they want to propose themselves as partners for projects. So they can use these. That should be active in few days. Then the last piece of information is that we will have a webinar on this topic. We have to define the date, but it will be in November. During the webinar, the presentation, the topic will be presented again by the topic presenter, and you can ask questions through a chat box. So it will be important also for people or colleagues who were not able to come here to the info day. They can follow again and have another occasion to ask questions about the topic. And these are, the contacts, the important contacts for us. And now I would like to introduce you the topic, the speaker, who is Aldo Tagliabue. Aldo represents Novartis. He has he has been in the field of vaccines for a long time, and so he will present this topic. Aldo, please.
Thank you, Teresa. Let's go to the next presentation. Teresa, this time. I think. So I will talk for the next few minutes, but I'm just presenting really a joint effort of some people, and I have to acknowledge that the presentation that has been extracted by the call that we prepare, all the work was coordinated by Pierre Hauser from GSK Bio, that has been very instrumental in preparing this call that we make together with the colleagues of Sanofi, Pasteur Emmanuel Tranois, and now is joining also Philippe Denuel to continue the work, and also Ed McCarskey from AstraZeneca. What we would like to do, I think everybody would like to be original and different, but I think in a way we are representing a group slightly different from all the course that you have seen. We represent vaccines, and vaccines are preventive medicine. So the problem that we have to face, as I will say in a few minutes, maybe there are no real problems, but we have to take in account the things, because when you vaccinate babies and so on, you have to be extremely careful, and side effects are very important. And within this call is in safety, I think is appropriate. The other thing which is important in this context of European colleagues, and must be stressed, still in Europe, the vaccine culture and industry is very strong. It's coming a long way. So I think we have the possibility, together with the academic and small medium enterprise, to do a very good work, and we are looking forward. The title requires already some little note, because of course when you talk about immunosafety of vaccine, and this call has been started to be discussed with Michel more than 1 year ago, when the pandemic flu was coming, and we knew that we were expecting a lot of problems. When you vaccinate billions of people, then you see a lot of effects that maybe are not due to the vaccine, but just the fact that you enlarge the sample could be rise to some issues. So when you talk about early inflammation in vaccine, I think this is part of vaccination. At some point, if you want potent vaccine, you have to pay a price. A little bit of fever, maybe at the end of the day or something like that. And people should accept this, but of course, it has to be just a minor side effects. The other thing, autoimmune disease, this is not associated to vaccine. This is more a concern than a real fact. We have been discussing in the panel, shall we put effort on this? We are putting effort on the idea of studying this, but so far there are no data that indicates that if you vaccinate people, you end up with autoimmune disease. The problem now that you have potent vaccine, you have the adjuvants, and you start vaccinate like happened in the pandemic. We included in the call pregnant mothers, young babies. So people are starting to think that that's in the long run, it could create some autoimmunity, which is not proof. But we would like with this call to disprove forever whether it is possible. And I think since the major mission of IMI is to eliminate the bottlenecks in drug development, this is very important instrumental. So having said so, the goal of this project is an harmonization, standardization, and to optimize the reporting also, because you heard anecdotal things, you know, it's very easy, and you go in the press and you go in the television, and you really make a lot of damages. And what's happening now after the pandemic, the people are much more against vaccine than before. And this is, of course, is a damage for the companies, but also since vaccines are really working, in the long run will be a damage for the society. Someone was quoting, I think it was Michel today, people having measles and things like this. There are vaccines available that people are not using, let's say, for ignorance. So I think this project is aimed to say some important word in the vaccine field. So what we would like to ask to the applicants to come up, we heard a lot of innovation idea or something like that, to come up with ideas to work together to predict early and late adverse events following vaccination. Of course, you use the word biomarkers. This is very general. It's becoming a little also maybe too abused. But that's what you want to have, to know whether you vaccinate a person, you have the possibility to induce side effects. And the tools that are coming more and more usable based on all the omics, on the genome, are giving us the possibility to really do a good work. So this is a general one, and something is coming after that. What we would like is provide guidelines and guidance for the vaccine community to assess to safety of new vaccine that will be accepted by the public. Because as I say, the problem is always the same. You vaccinate people that are healthy, not that have diseases. And these rules are needed also for manufacturers and regulators. So we have to work together because, of course, the pandemic last year was mismanaged. There were a lot of problems, but it's not forgotten, or maybe it's forgotten in the media, but we are always facing the possibility that we will have a real problem. People already forgot, we've been talking about the swine flu, H1N1, but now we don't talk anymore about H5N1. This is still around, and there are cases in Egypt with a lot of Europeans are going for vacation. And in the case of H5N1, the mortality is still 50%. So that's very high. And so, of course, as in the previous project, we have to look and data that are available in the company, clinical trials has been done before, and collect and organize all these data to better understand the etiology of autoimmune disease. That's a problem. When we started to discuss the things, then we realized, some of us, I didn't know, even the information about the frequency of autoimmune disease and so on is not so available to everybody. So this will be an occasion to serve the vaccine field, but also to understand a little bit more about our immunity. And this will be particularly important now that you can use the tools of deep sequencing and other things to annotate genome on different population. And the other thing that we never consider that is what happened before, previous infections, because also the infections are changing our capability to respond to other events. And sometimes, you know, the stimulation of the immune system is not specific. You get in disease and you promote response also against other disease that you have conserved the memory in terms of immunological memory. So I think with the colleagues that this will be a very interesting exercise and very, very interesting project.